In the United States, the past 2 decades has seen a dramatic rise in the recognition of chronic pain. To date, research has shown that more than 30% of the adult U.S. population suffers from chronic pain on a daily basis. In response to this problem, the established medical system addressed this burgeoning health issue by implementing the routine practice of prescribing powerful opiate medications to treat patients with chronic pain, hoping to improve their debilitating symptoms and help restore them to an improved quality of life. However, the applied solution of chronically prescribing potentially dangerous and addictive medications led to unintended consequences, which ushered in an entirely new set of problems of epidemic proportions: prescription drug abuse, addiction, and overdose deaths. When the problem of treating increasing numbers of patients with chronic pain was recognized, an immediate solution or quick fix was applied that failed to realize the serious, unintended consequences that would result, and created a system that continuously reinforced and perpetuated the original problem. This scenario is best described by the archetype fixes that fail. Medical practice guidelines are again evolving, and medical professionals are struggling to find a balance between the appropriate treatment of chronic pain and the escalating use of opiate medications. The following presentation portrays a team of physicians working to develop a rational approach to this complex problem. With some guidance of an unexpected mentor, this team may indeed begin to better understand the problem and work to resolve the fix that failed.
Edith, we've been working on this problem for weeks, and I just feel like we're not getting anywhere with it.
Yes, more and more of our patients are being managed with opiate medications, and it's really a big concern. Several of our patients have been hospitalized in the last month due to complications from their opiate medications, including that one fellow who almost died from an unintentional overdose.
I know, and it seems like our patients are really no better off when we're prescribing these medicines, and we just keep escalating the dose, and all we really see is more effects from abuse and addiction and even overdose, like the guy you mentioned. You know, Edith, I think we really are going to have somebody, an outside consultant, to help us with this problem.
I agree. We need extra help here.
Hello, Dr. Edith Winter and Dr. Jordan Hancock. I'm Porter 65. I'm an advanced artificial intelligence entity. I have an integrated network of cognitive programs that allows me to analyze complex data sets and synthesize an infinite number of possible solutions. I have been analyzing your problem of treating chronic pain with opiate medications. As you have already identified, this problem has gained close scrutiny by medical providers and patients alike. The solution that you have been applying, which relies on using opiate medications, will inevitably lead to serious unintended consequences, namely drug abuse, addiction and overdose deaths, unless careful consideration is given to designing a system that accounts for the delicate interactions of carefully selected input variables and determinants. If I may offer some constructive criticism, you are trying to understand your problem by utilizing linear thinking. Unfortunately, linear thinking fails to recognize the inherent causal effects that occur when highly complex systems interact. You need to abandon this linear thinking for a more robust approach. I would suggest applying systems dynamic thinking.
I like that name. What is systems dynamic thinking?
Dr. Winter. Systems dynamics is a methodology and mathematical modeling technique that is used to frame and understand complex problems. Systems dynamics allows for the selection of specific populations, or behaviors, to be examined, and applies selected input variables to them, in an effort to understand and predict how the population or behavior will change over time. In order to completely understand the problem of chronic pain, opiate medications and addiction, we must define our stock populations and then apply a comprehensive set of select input variables to see how the behaviors may, or may not, change over time. Your task is to determine the precise variables, applied at the exact locations, that will lead you to a fundamental solution. Please allow me to show you what your problem would look like in a typical systems dynamic model.
Whoa, Porto. I don't even know what I'm looking at here. This has got my head all twisted around like a pretzel. Do you think you could break it down for us human intelligence types?
Dr. Hancock, I apologize for moving ahead too quickly. I will start from scratch, as I do not want to twist your brain like a pretzel. You see, getting to a solution for your problem, using systems dynamics, begins with the construction of a causal loop diagram. This diagram reveals the cause and effect relationships which exists between the key variables of your problem. Begin with identifying your target problem as the behavior of chronic pain. Next, apply your solution of treating this problem by simply prescribing opiate medications. You will note that these variables interact with one another, as illustrated by the arrows in the diagram. This identifiable interaction creates a negative feedback loop that appears to create a balanced solution to the problem. At this point, you would be tempted to conclude that you have achieved a successful solution. However, a more in-depth understanding of the problem reveals that over time, a delayed effect will emerge from the variable of opiate medication, namely drug addiction. This delayed, unintended consequence will also exert a causal action that feeds back on the original problem of chronic pain, causing a perpetuating effect, thereby reinforcing the original problematic behavior. As you can see, this approach cannot achieve a sustainable solution. This construct is best defined by the archetype, fixes that fail. In order to resolve the archetype of fixes that fail, there are several possible courses of action that you can take. First, you must search for interventions and solutions that address the root problem, thereby forfeiting the quick fix that only works to solve the symptom. Instead, you will need to generate and apply a well-developed, fundamental solution. Second, you must recognize the unintended consequences that may occur, and select interventions that better mitigate them, and result in less harm.
The unintended consequence, but how are we going to get at the solution to the fundamental problem? What I mean is, how do we get people to move from the stock of persistent chronic pain to the stock of improved physical and psychological function?
Let us agree that in order for you to be successful in implementing a fundamental solution to your problem, there will have to be a behavioral change in your key populations. This is seen as movement from the stock variable of persistent chronic pain towards the stock variable of improved physical and psychological functioning. This movement will be dependent on the rate of flow from the one population toward the other. We will define this flow rate as appropriate chronic pain therapy. Variables that impact this flow rate will directly influence the behavior change that you are seeking. What you will hopefully find are the leverage points in your system. Leverage points are specific locations within your system where even a small influence can exert a dramatic effect. As you will see, the right variables applied at leverage points will create significant behavioral change. I would ask you both, as well-trained physicians, what variables could be applied to promote the flow from persistent chronic pain towards improved physical and psychological functioning?
Well, I think that first of all, we could think about using non-opiate therapy. We could start with non-opiate analgesics like NSAIDs, and then we could do mental health counseling and appropriate psychiatric medications. And then there are alternative therapies like biofeedback, acupuncture, physical therapy, and exercise therapy, which have all been shown to improve chronic pain.
I agree with you, Edith, but there's no reason that we can't continue to use opioids. We just have to do it responsibly.
Dr. Hancock, I like the way you're thinking. What do you have in mind?
Well, that's a good question, Porto. I think in order to do this, we have to increase medical provider awareness of risk factors for needing long-term chronic pain therapy, and also those factors that lead people to be susceptible to abuse and addiction. We We also have got to change patients' behaviors and expectations in terms of their chronic pain and the therapy that they'll receive, as well as societal attitudes towards chronic pain and people who have chronic pain. We're also going to have to align our policies and legislation better with factors that are supported by the medical literature.
Well done. The two of you have provided a very diverse and rich set of input variables that act on your leveraged points. Your variables represent the diverse nature of the factors that influence your system. If I may offer a few more variables for you to consider, that would also influence your fundamental solution. First, as you both well know, there is increasing pressure on physicians to utilize prescription drug monitoring databases. Medical research has shown that the use of these databases greatly reduces the risk of abuse and diversion, thereby making opiate prescribing and its use more selective and safe. You can see how this variable feeds back on your leveraged points, exerting significantly different influences on each. Second, I would also like to expand on your insightful mentioning of the effects of education and research. They will both have significant effects on all of your variables. Notice how the influence of more education and research for physicians, patients, the general populace and policymakers feeds back and begins to reveal the inherent causal feedback loops we spoke of earlier. Finally, you might note that your system's dynamic model has also identified an interesting negative feedback loop between the leveraged point variables of non-opiate and opiate therapy. This virtuous cycle creates a balanced, harmonious system that will ensure the steady flow of appropriate chronic pain therapy.
Yes, I see now how our problem can be defined by modeling key stocks and showing how flows move behavior from one stock to another by selectively inputting key variables and determinants, and then we can predict how behavior will change.
You know, Porter, you're pretty good at this teaching thing. You ever considered a career in education?
You are very flattering, but I think it is time for me to get out of that game. I'm a little tired of the whole faculty FTA race.
So, what are you going to do with all your spare time? Are you going to read a bunch more books or crunch some big data?
Those sound like outstanding and fun things to do, but instead I think that I am going to spend quality time with my family and a good bit of time working in my garden. Who knows? I may even learn to love exercising. I have also heard that some relative amateur over at IBM called Watson is making a killing doing TV commercials. So maybe I'll give that a try. I am excited about things. You know, the future is so bright. I just gotta wear shades.
You know, Porter, I think we're all going to need a pair of shades. Team 4, we're now statistics.
At the Beach Clinic, Team 4 is using systems thinking. Thanks, Porto.